Good morning. This is Dr. Kathleen O'Neil-Smith from Treat Wellness in Newton, Massachusetts. So, there's a lot of hype around the COVID-19 virus, this new virus that is really wreaking havoc on our lives. And it's really important to take this seriously. And so that's why I'm doing a video. I think the most important thing is limiting exposure. So it is really imperative that you think about not exposing yourself to people around you. Let me give you an example. There was an outbreak from a scientific meeting in Boston with a relatively small group of people. Somebody who was not at that meeting, my neighbor, who was not at that meeting but worked in that same office, tested positive because they tested everybody in the office for COVID-19. So she is now at home, working from home on quarantine, asymptomatic, fortunately. So many people will be asymptomatic. So you don't know who you're exposed to and who you can give this to that will give it to somebody else, 3 people removed. That's the important thing to think of. So we have to limit exposure. We have to stay out of busy places. We have to stay with small groups of people that we know are not out traveling or not in big groups, etc. Because if we are exposed and we do not get symptoms, which most people will not get symptoms, especially healthy people, we basically do not want to give it to somebody who is vulnerable, who has other medical conditions, and whose immune system may be weakened or compromised. So what do you do if you think that that you've been exposed? The most important thing, if you think that you've been exposed, is to get testing. We have testing in our office. There's testing available in offices. And if you can't find testing, it's really important to find out where the nearest place is to get testing. So getting tested to find out whether you're positive for COVID-19 or not is really imperative if you think you've been exposed. And that's what happened for my next door neighbor. She didn't have symptoms, but she knew she was exposed, so they tested everybody in her company. So getting tested. If you have a sore throat or a fever, you should consider, have I been exposed and being tested for sure. And if you have any of those symptoms, you definitely want to quarantine yourself, because you will have been contagious before that, but once you know you have symptoms, you really have to be responsible, socially responsible. So 20% of people are going to have to go to a hospital with this. 20% of people who get this are going to have to go to a hospital. Maybe 5% of those are going to need a respirator. The other 15% are going to need some support, some IV therapy, nebulizer therapy, etc. The other 80% of people who get exposed will be able to be at home. 40% will be symptomatic and 40% will be asymptomatic, not have symptoms. So you never know who you are, which is why limiting exposure is really, really important. What do you do with your elderly parents or your elderly aunt and uncle? You stay away. You talk to them by phone, you Skype with them by phone, you send them food, but you do not go and visit them. You do not expose them, particularly if you think they're vulnerable, because that's the population, if they're vulnerable, that will end up in the hospital, and there may not be enough beds, because this is going to peak very rapidly. Week 1 it may be 10 cases, week 2 it may be 1,000 cases, and week 3 it could be 10,000 cases, and that's the issue. It hasn't even peaked in Italy yet, and we know what's going on there, which is why they've taken such extreme measures. Very, very important. One interesting note, there's a process that happens that's a little bit different with COVID-19 versus the flu, and that has to do with the inflammatory storm, the inflammatory reaction within the body that we believe is in something called an IL-6, an interleukin-6 reaction. There is an autoimmune medication on the market that Roche has made, a monoclonal antibody that may be helpful for people who are sick. And it's my understanding that Roche has agreed to make this available for people who may be in the ICU, because they know that it's been helpful with mitigating the IL-6 storm. So that's something to be hopeful about. But I think this will pass. This will pass. When? I'm not sure. But we need to be thinking about it has not peaked yet. So until the peak, I really advise you to keep your immune system boosted. Sleep well. If you are not sleeping, your immune system will be compromised. Eat well. You need those nutrients. nourishing, nutritional food to keep you healthy. Move a little bit around the house. Don't become a couch potato over the next few weeks. And stay away from people and self-quarantine and be relatively quiet with your exposures. But I know that you can order online anything you want. Now, there are other immune boosters. Vitamin C is a wonderful immune booster. There's something called transfer factor. It has multiple components to it. It's really, really good in terms of boosting natural killer cell activity and fighting viruses. So there's a variety of different components to the line of the transfer factor type of immune booster. Vitamin D, omega-3, but again, eat well. Eat your colorful fruits and vegetables, limit alcohol, sleep as well as you can, and wash your hands. Wash your hands with soap as long as you can, and wash surfaces and keep them clean, because this virus can sit on surfaces and can be transferred that way over a short period of time, like 1 to 2 days. So keep all those things in mind. Are there any questions I haven't answered? Asking my pre-med student here. No, everything's good. So take care of yourself, take care of your loved ones, be well, keep a smile on your face, because that will boost your immunity, and we'll see you soon.